Welcome back. Dr. Mandara, why did you stop practicing medicine full-time? Why did you decide that rather than that, you'd like to go into developmental work?
Health developmental work. I actually started my journey as a young physician and later trained as an obstetrician and gynecologist. And my experience going through that, particularly practicing in far north Nigeria, in Zaria, I see a lot of preventable diseases come through my door. Vesicovaginal fistulae come in when young people get married very early, and in the process of childbirth, they crush their bladder, and so therefore they leak through the urine. As soon as they pass you, they smell urine. I've seen a lot of young girls at the age of 15 die during childbirth. I've seen women give birth for the 10th and the 13th time, and in the process, they lose so much blood that they die. I've seen women do this hot bath that is seen Wankanjogo in the north, and taking gruel made from potash, and they die. And I said to myself, I mean, seeing one person at a time, I was not satisfied, quite frankly. So I went into public health and preventive medicine, and that's what has brought me into development. So if 100 women will run through the hospital today with, say, severe anemia, I'm trying to position myself whereby we could reduce that to probably 20, because the other 80 have done the right thing. They've eaten the right food. They've taken their antenatal drugs. They've done all that is taken to actually prevent them from getting there. Positioning myself in such a way that women find themselves in a position where they can make decisions on life situations rather than be totally dependent on the doctor. Yes, I still feel that way.
Now, outside your official work that you do with the foundation, I also understand that you don't necessarily rest during your own private time. You actually carry on this work with sort of various foundations that you support. Tell me a little bit about that work.
In my spare time, I do spend quite a bit of time working and supporting an organization called Girl Child Concerns. And basically what Girl Child Concerns does is it goes into rural areas and find girls that are intelligent but are from an extremely poor background, that have no hope of ever going to school. And we fish them out, we send them through secondary school, and we support them from Form 1 to Form 6, and where we can, we try and situate them in tertiary institutions. In about 2010, we had about 230 girls graduated from our scheme, and at the moment we have about 176 girls on our scholarship. So that's what I spend my spare time doing.
And the funding for this, how do you scout for money to keep this going?
Okay, now that you've asked Kadaria, what we do is we ask people we come across to support a girl. So I really appreciate if you could support one girl. It will make a lot of difference to her. So this is how we do it. And so I'll follow up after the program.
Blackmailing me on air, basically.
No. I'll follow up after the program to see. This is how we do.
Is it expensive, though, on a serious note? So how much would it cost, for example, to train a girl? And if someone listening to us were to think, oh, this is a great idea, I'd like to support this, what do they need to do?
So actually, in the Girl Child Concerns, and what we do is actually out there in the open in our website, girlchildconcerns.org. It's it's a package. So any girl we adopt, we pay for her school fees from Form 1 to Form 6. We buy all of her books from Form 1 to Form 6. We make sure she has uniform in the school. If the school requires mattresses, lockers, and school shoes and exercise books, we do all of the academic things from Form 1 to Form 6. But in addition to that, every girl on our scholarship also attends our annual life skills workshop. Once a year, we bring all the girls on our scholarship for 1 week of camping at Queen Amina College, and we stay with them. We talk to them about life skills, and we probably will we also invite women that have made a mark in their lives to come and spend a full day with them, so that at the end of one day, one girl, a couple of girls will say that their names are Kadaria, and you will see they will be joking, and they will actually disturb you to mentor them. So the package is the school fees. all the school needs, the life skills, annual life skills workshop, and each of our girls also signs up to mentor 5 children. And it doesn't
Herself.
matter, herself. Oh no, she
back.
has to start giving back.
Okay.
Now and that's costing us about 120,000 naira
annually.
Annually.
Per girl. Okay. So the website again is
www.girlchildconcerns with an S.
Girlchildconcerns, one word.
Yes.
.org.
Yeah.
Now, so this is secondary school. This then presumes that the children you support actually made it through primary school. Do you have anything for the younger ones, or are you planning to do anything for the younger ones who?
Actually, we take them at the end of primary 6. And so what we do, we don't directly work for the younger ones, but all of our girls are mentors to at least 5 children. So with our 176 girls at the moment, multiply by 5 little children. That's the number we have.
Finally, I have to ask you this. You are a practicing Muslim. Very vocal about your faith, very proud of the work that you do with the Association of Muslim Women nationally. How much of an impact has your faith had on the work that you do?
For me, I think I don't see demarcation between your everyday life and your belief. For me, my being an obstetrician, I'm hoping will be my probably gate pass to heaven. I believe that giving back to the communities that we are coming out from by supporting girls to have an education. After all, the only difference between me and any woman is the fact that my father saw the foresight to give me an education. And because of that, I feel obligated to have to give back. This is an integral part of my being a Muslim woman.
Dr. Mandara, thank you so much for being a guest on the program.
Thank you very much.
You've been watching Straight Talk with me, Kadaria Ahmed, and my guest was Dr. Mairo Mandara, Nigeria's representative of the Bill and Melinda Gates Foundation, with whom I discussed the work her foundation is doing, the impact of the insurgency on that work, and the criticism they sometimes face for their work on giving women access to contraceptives. Join me next week when I'll be in conversation with another special guest. Have a good evening.